Great. Those were some awesome questions that you all had, and you guys are really thinking about how to utilize these things in your place of work, so that's great. We're now going to switch gears from me talking, and you all are going to have a chance to practice. So our role play activity today centers around cultural differences in postpartum care. So here's a brief overview of the exercise. You're going to start by being in groups of 3. So everyone will need to be in a group of 3. If you can, try to sit in such a way that you're facing each other. So I'll give you a minute to rearrange yourselves, and then we'll come back and continue. Great, it looks like everyone has a group. All right, so in your group, each person will have a chance to be each of the roles. In this activity, a patient is being discharged from the hospital following the delivery of a healthy baby. Each group will have a healthcare provider, a patient, and an observer. The doctor will be sharing postpartum care procedures, and the patient is from an Eastern culture whose first language is not English. The observer will be watching the interaction and recording observations. Take care to practice the communication techniques that address cultural and linguistic challenges and encourage patients to ask questions. Those are our 2 main ideas for today. Lastly, you're going to learn from others. Each person in the group will have a chance to observe, and this will allow you to see what worked, what didn't work, and for you to learn from other people with different experiences. Here are our objectives. First, to practice the techniques that we discussed today. Second, to become comfortable with using those techniques in this setting. And then after you leave, the idea is that you'll be able to utilize these techniques in real patient interactions. I have a couple rules and some other key information. The first rule is please stay in character. I know we're not actors, but you can try. Second, observers should silently observe. If you see something that happens that is a bad thing, just write it down and I'll give you time at the end to talk in your groups. So here's the time frame. For each rotation, you'll have 10 minutes, so altogether we'll role play for 30 minutes. And then at the very end, I'll give you about 5 to 7 minutes to discuss observations. What will you need? Each group has been given a packet. In this packet are 2 role cards, 3 observation forms. Each person will be given a role, and the observer will fill out the observation forms using a pen or a pencil. And then I will keep time on the screen or with my clock and let you know when 10 minutes is over, and you can all switch roles, and then when you should start and when you should finish your group discussions. So here are the different roles. The observer is just going to record observations. The doctor is going to share postpartum care procedures, and the patient is from an Eastern culture, and English is not her first language. So first, please assign each member of your group a role. Remember, everyone will have a chance to be each of these roles, so the order doesn't really matter. Second, I'll give you a few minutes to read through the background information, and I'll walk around if you have any questions about that background info. Then, for 10 minutes, please role play the interaction, and the observer will take notes on what he or she sees. So let's look at the roles just kind of quickly as a group. The first one is a doctor. So this doctor is seeing his or her patient, Ms. Chow, and she is a 30-year-old first-time mother. The doctor's job is to share information about postpartum recovery. So things like rest and enough sleep are important, the importance of breastfeeding, the importance of eating a balanced diet for the new mom. Ice can be used to reduce swelling and soreness. Soaking in a warm bath can help alleviate soreness as well. And then the importance of taking baby to its first well baby checkup. Remember, you want to address any cultural or language differences, and also you want to encourage Ms. Chow to ask questions. Next we have the patient. So the patient is a 30-year-old first-time mother. Her name is Fun Qin Chow. The English pronunciation is kind of like Fun Qin Chow. If you can't pronounce it right, that's okay. The doctor is sharing information about the postpartum recovery period, but some of the suggestions clash with the patient's culture. In addition, English is her second language. So here are some potential cultural clashes. First, in Eastern cultures, women avoid anything cold for the first month after birth. This can be cold drinks, this can be ice. Anything that's cold, air conditioning, they generally will not use. Secondly, Many women in these cultures avoid bathing, washing their hair, brushing their teeth, or showering during the first month after birth. This is believed to help with recovery. Third, many babies and mothers will not leave the house at all during the first month of after baby's birth. In this patient's culture, breastfeeding is something that only the very poor do. She can afford formula, so she would like to formula feed. And then finally, in this family's culture, the mother-in-law is the one who will be making most of the decisions regarding both the new mom and the baby during the first month. So as you can see, there is already a potential for some cultural and linguistic challenges. Finally is the observer. The observer can use this table to rate the interaction, and you'll see that it reminds the observer to be looking for the things we talked about today, asking about the pronunciation of the name and informing about language assistance services for creating a welcoming atmosphere. To communicate clearly, you want to make sure you ask about who the decision maker is. You want to speak clearly and slowly, and you want to use living room language. Then you want to check for understanding. Are you looking for ways to use nonverbal communication? Did you utilize the teach-back method? Finally, how well did the doctor do in encouraging the patient to ask questions? Did the doctor ask the patient 4 questions? Did the doctor reassure the patient that it's okay to ask questions? Did the doctor ask the patient questions? And did the doctor mention having commonly asked questions? At the end of this, you can write down some comments, things that the doctor did well, things that the doctor could improve on, things you wish the doctor had done, anything like that, and then you can talk about them at the end. All right, so everyone has had a chance now to talk and play each of the roles. So here are 4 questions you can talk about in your groups. What were some difficulties that occurred during this interaction? What were some ways the healthcare practitioner was able to address those difficulties? How was the HCP able to address the cultural and linguistic needs of the patient? And finally, did the HCP encourage the patient to ask questions? Okay, I'm excited to hear now from each group their answers to these questions, and we'll just talk about them together. So first up, what were some difficulties that your group noticed during this interaction? Awesome. Second, what were some ways that the HCP was able to address those difficulties? What were some good things you saw in your groups? Great. How was the HCP able to address the cultural and linguistic needs of the patient? Okay, and finally, how well did the HCP encourage the patient to ask questions? Wonderful. Well, what questions are there at this point? We've talked about strategies, we've talked about why this is important, and we've done a role play activity. So does anyone else have other questions? All right, well, thank you all for letting me come today. Here's a list of references. If you have further questions or concerns, you can come up and talk to me after this presentation is over. It's been great meeting you all, and I hope that you all feel equipped to go out and be culturally, linguistically, pay attention to those needs, and also encourage your patients to ask questions. Thank you so much.